Hi, my name is Dr. Prashant Nayak. I am an associate professor in the Department of Obstetrics and Gynecology at All India Institute of Medical Sciences, Raipur. Well, today we are going to talk on a very important disorder of the females or a disease of the females that is called PCOS. PCOS. Some people also call it as PCOD. What is this PCOS? The full form is polycystic ovarian syndrome. Well, I must mention that the month of September every year is being celebrated as PCOS month, and this is being done with an intention to create awareness and among the people about this health disorder, because this is definitely a very important health disorder of the females. That's why all these initiatives has been taken. Well, there must be questions in your mind that what is this, why this PCOS is important, and what is the cause of PCOS, and how does it present, and how we can treat this condition. Well, I must say that PCOS is a condition which has no defined etiology. In fact, it is a multi-genetic and multifactorial in origin, with a manifestation which usually appears in the form of either irregular menstruation or some features of hyperandrogenism, that is excessive testosterone in the body and its effect. And also in the long run it may lead to infertility and so many other problems. Well, going to very specific that this condition having a variable range of manifestations and without any definite cause is a very important disorder affecting around 6 to 10% of the females in our country or even worldwide. Well, if the incidence is up to the range of 10%, that means it's definitely a major concern, health concern. Well, then what is the how does this disease occurs and how it is being diagnosed? Well, I must say that the signs and symptoms can be recognized easily by the patient herself, or even if she goes to a gynecologist, a doctor, a treating physician who deals with conditions of polycystic ovarian syndrome. Usually, it affects young girls or young women up to also it affects the elderly and perimenopausal women, but more often found among young, and it is mostly associated with either a irregular menstruation, as I told, and majority of them have a kind of oligomenorrhea, means either they have a menstrual cycle duration, means the gap between two menses either more than 25 days, 35 days, if they have crossed 3 years of their menarche, or if they are within 3 years of their menarche, this menstrual duration is usually more than 45 days. And again, if it is less than 21 days in either cases also, that means a woman having a intermenstrual interval of either more than 35 days or less than 21 days beyond 3 years of menarche, or within 3 years of menarche it is more than 45 days, that means it is a kind of irregular menstruation which indicates oligoovulation or abnormal ovulation. Similarly, if a girl or a woman is having features of hyperandrogenism or hyperandrogenemia, that means her blood level of testosterone or male hormone, that is androgen, is increased than the normal level for women. Each woman have some amount of androgen in their body, but it becomes excessive. That's why they have hair growth, abnormal hair growth in their face, in the beard area, in the upper chest, even in the abdomen, in the back, and also there is a male pattern of baldness that they get balded, and there excessive development of pimples. There will be pigmentation in the nape of the neck, even the axillary area and other intragus areas. So usually it is a matter of concern because it disfigures and it causes a lot of embarrassment. Similarly, and these women have, if they are married, they may suffer from infertility. That means they are unable to conceive a child. So this is another problem. So these are the subtle form of manifestations usually they come with, but when we take a proper history and examination, usually we advise a ultrasonography. In the ultrasonography, usually a transvaginal sonography if she is married, else a transabdominal ultrasonography used. If the ovarian volume is more than 10 cc on either ovary or both ovaries, or the number of follicles in the transvaginal sonography is more than 20 within a range of size 2 to 9 millimeter, then we coin the diagnosis as polycystic ovary. But if she is a young girl within 3 years of her puberty, usually we don't consider the ovarian follicles. Rather, we don't take the ultrasound criteria as the diagnosis for polycystic ovarian syndrome, because it is normal for that age group. Well, as I told, the manifestation already I told you the common manifestations, but not only it causes features of hyperandrogenism or irregular menstruation or infertility due to anovulation, but also it has other effects on the body, other long-term and short-term complications on the body. To understand that, I must tell a very few lines on the physiology of this condition. What happens? There occurs an increased insulin resistance in this disorder, for which the sex hormone binding globulin in the blood circulation is reduced. That leads to increased level of serum estradiol, that is the female hormone estradiol is increased. Because of increased estradiol, the FSH, the follicular stimulating hormone level is reduced. That leads to decreased growth of follicles. At the same time, their LH level, the luteinizing hormone level is increased, for which there occurs fecal hyperplasia in the ovary, leading to excessive level of release of androgen, and this is the cause of hyperandrogenism. And both androgen and excessive estradiol that acts abnormally on the uterus, and along with the abnormal levels of FSH and LH, that leads to a kind of irregular menstruation, and this has impact. I told you there occurs insulin resistance, that's why there occurs hyperglycemia, that means she may develop diabetes. And not only that, it also affects their lipid metabolism, that's why the cholesterol level in the blood is also increased. Well, along with that, because of excessive estrogen in the body, it acts on the breast, it acts on the uterus and other body parts, so they have a future chance to develop uterine cancer, even breast cancer. And excessive cholesterol, as I told, also has a future impact to develop heart diseases, hypertension, and cancer in other parts of the body also. So as you can see, it has not only a short-term impact but also a long-term impact. And the most important part, as I told, that because it disfigures, so a lot of psychological anxiety, there can be depression, embarrassment, and also because they are unable to conceive after marriage, so they also come with all these complaints of infertility. So it has an impact on the fertility of the female also. So overall, we have seen that this is a disease which has its impact ranging from irregular menstruation up to the level of infertility, including the metabolic disorders, what I have told. Then how we should tackle this disease, how we can treat it? Well, as I told, it is a multifactorial and multigenetic in origin, so there is no clear-cut treatment for this condition. Rather, depending on the kind of manifestation, so we can treat the patient well. She has excessive hair growth and androgen features, then we can remove the hairs by laser or by depilation technique, and we can reduce the level of the blood circulating androgens by giving various medications that we have. And at the same time, if she has high blood sugar, we can treat that by anti-diabetic medicines. Also the blood pressure or the cholesterol level is increased, so we can also treat that. But those are symptom specific treatment. But the most important treatment for this disease is lifestyle management. Remember, lifestyle management, which includes a regular exercise, a healthy diet, and a healthy lifestyle. That means, so a regular exercise will cause weight loss if they are obese. Even if they are thin built, it will also help them a lot by balancing their body metabolism. Their insulin resistance will be reduced, their cholesterol level will also be reduced. Else, by taking a healthy diet, as I told, healthy diet means we should avoid junk foods, we should avoid animal fat, sugary drinks or junk foods, as I already mentioned. But at the same time, we should take more of fiber based food, more of antioxidant based food, green vegetables, lean fat meat, and less fat dairy products in fact. So all these together along with the exercise will reduce the abnormal metabolic factors and reduce the insulin resistance. That will reduce the androgen levels. So in the long term, she will have a benefit. Gradually she will have regular cycles, and other abnormality will be reversed. So the most important management is a healthy lifestyle management. Well, I told, for any specific disorder we can treat accordingly. So for that you have to go to your doctor. Well, I think this is a very brief information regarding polycystic ovarian syndrome, which will help all of you in understanding this disease. Thank you very much.